Series of modern bark paintings by Patty Bertucci, one of Australia's most talented contemporary bark artists. Part 1, a series of portraits in the office, in the operating room, back in the office holding a spear. I then asked Patty to do a series of x-rays. The first time x-rays have been drawn onto bark. Here's a fracture of an ankle involving the outside and the inside of the ankle. Here's a post-op x-ray of that ankle with a fix. See a plate here and screws on the inside part of the ankle. Here's a fracture of the femur. See the thigh bone that's broken. And here it is operated on. See, a nail down the middle, cross screws. So post-op x-ray. And here's a broken hip, intertrochanteric. And here it is operated on. See a plate and screw, plate, screw plus another derotation screw. Post-op x-ray of a hip knee replacement. Post-op x-ray of a hip replacement. And here's a patient prior to surgery. See, they've got Dupuytren's contracture of the ring and little finger. Here's a photograph of a toe, painted gangrene of the toes before surgery. Here's an intraoperative photograph. There's an incision here in the palm of the hand, probably for a ganglion operation or a trigger finger. Intraoperative photograph of severe degloving injury of the hand. See, the fold has been folded back. See all the blood vessels and nerves and bones. There's a serious injury of the hand, of the index finger with cellulitis and swelling, and of the thumb. There's a picture of a plate, a bent plate that's been removed. You use these for fractures. Here's a patient prepared for surgery. See, it's the elbow. There's a big bursa there full of gouty crystals. Here's a picture seen in the clinic. Hallux varus, the toes are pointed inward. See on both sides a congenital disorder. This is a patient who had a bad burn injury at the back of her foot and required extensive debridement. This is the hand of a patient with big gouty tophi. These are the pockets or accumulations of gouty tophus on the back of the hand. It had to be excised. This is a contaminated tibia, bone sticking out, mud, and contamination in the wound. This is a patient after an amputation below the knee, some breakdown of the skin, an operation at the front of the elbow with the incision seen. An injury to the hand, of the back of the hand with severed tendons going to the long and ring finger. So what you've seen here is actual bark paintings done by one of Australia's outstanding contemporary bark artists of x-rays, never seen that before, of clinical conditions and of patients having surgery. So that's the first for you, using bark taken from the eucalyptus trees. I hope you enjoyed.